Hello, everybody. My name is Elijah. This is Charles. This is Dr. Paul Homoly.
Yeah.
We're so excited to come to you guys live and talk about this amazing podcast, live cast, Drive Your Dental Practice with Dental Implants. And you know what, Charles, you are the man behind the scene with Driven Dental Implant Marketing. You have all of these things that are going on in the back of your head. You're so detailed. I have so much love for everything that you have to bring to the podcast. And for all the people out there that don't know who I am, my name is Elijah Desmond. I am also one of the co-owners with Charles with Driven Dental Implant Marketing and also Smiles at Sea. And I just absolutely love seeing the big picture of things. So you'll see me chime in with some big picture things, Charles with some fine details and more strategy. And oh my goodness, how amazing is it to have the Dr. Paul Homoly? And I've seen him on the magazine covers. I've seen him on stage. You've seen him everywhere. He is known for case presentation, high value cases, and also he is really known in the supporting of the KOL world. I would call him the ultimate KOL of the KOLs, influencer of the influencer. It is such an honor to have you on our live cast. So first off, I appreciate you coming on board, Dr. Homoly.
Yeah, well, thanks, Elijah. You know, and all those things you said, it's great. But I think what's really important for our listeners to know is that I practiced dentistry for 20 years. I've been in the trenches. I know what it's like to have a complex care practice. You know, I placed my first dental implant about 1978. 1983, my practice evolved to be all implants, and I fully retired from the clinical practice after 20 years. So I understand the good and the bad and the ugly of complex care dentistry, what it takes for patients to say yes. So I just want everybody to know that I'm not some armchair guy that talks about things that I've never done. I've lived it, I've taught it, and I'm ready for your questions, Elijah. So, and Charles, you too, bring it on.
That's awesome. Thank you so much, Charles. Do you have anything to add before we get started?
No, just super excited to dig into this. I mean, from our clients and prospective clients' perspective, all the different strategy calls that I've had with people who are interested in doing more implant dentistry in their practice, case presentation is probably one of their biggest challenges. And so we get to dive deep and dig into the mind of someone who's been there. I mean, Dr. Homoly, you just said, you know, you transitioned your practice into an implant-focused one. And that's the path that our listeners and our clients are on right now. And so being able to get your insights on how to do that the best way is going to be really exciting.
Yeah, I logged about, you know, at the end of my practice, I looked at what I'd done. I had implanted and restored about 4,500 patients with partial or full mouth reconstructions using dental implants. I'm a general dentist. A third of my patients were referred from other general dentists. I employed specialists in my practice, other general dentists to handle the bread and butter side. I ran a commercial dental laboratory in my practice. So I had headaches in places where most practices didn't have headaches. Anyway, bring it on.
Absolutely. So we have about 5 questions for you today, and I'm sure there'll be more to come, but I'll start off with case acceptance is the engine of the dental practice.
That's right.
Practices stall. What's the big picture of case acceptance, and how do dentists improve case acceptance?
That's the question I hear all the time. How do I improve case acceptance? Or here's a better one. What should my case acceptance percentage be? Here's the deal. Although asking how to improve case acceptance is a good question, the better question is not how to improve case acceptance, but the better question is, what kind of practice do you want to have? You see, the deal is with case acceptance is the rudder of the practice. It really directs the practice in the direction that it's going to go. Practices evolve in the direction where the dentist has most success with case acceptance. So a dentist could have, let's say, 100% case acceptance for dentures, but if they hate doing dentures, that doesn't do them any good. So the better question is, what kind of practice do you want? Then you're more capable of asking the question, well, based on the practice, how do I improve case acceptance for that type of practice? Does that make sense?
Absolutely.
Totally. And in fact, I'm thinking of certain clients, Driven Dental Implant Marketing, our whole focus is to help our clients attract and convert dental implant patients.
Sure.
And so we're generating leads, and these patients are coming in, they're having consultations. But what we find sometimes is if the doctor isn't as clinically comfortable with some of the more advanced cases, they end up doing more crown and bridge and some of the other stuff that maybe doesn't involve implants, but can still get the patient the smile that they're looking for. And they end up going that direction simply because that's kind of where their confidence is in terms of case presentation. So they're still high value cases, but they may not involve implants, even though that's what the patient walked in the door for.
That's the mistake of dental implants. See, I experienced the same thing in my practice, Charles. We marketed exclusively dental implants, but we had patients coming in saying, well, if you can do dental implants, can you just make my front teeth pretty? So I had full-time general dentists who had terrific cosmetic practices in my practice. I never advertised cosmetics, ever.
Yeah. Yes, we see that as a side effect of our marketing campaigns. You'll get patients walking in and they think dental implants are the solution, but really they just have a dental problem, and we've got dental solutions. And it's just about helping them find that right solution and explain it in a way where they're excited to say yes. So let's keep going. What's next, Elijah?
Well, to finish answering the question about case acceptance, think about it as, in very general terms, what type of practice do you want? And if we can really simplify this, there's really two types of practices. There's a modest care practice, to where it's kind of bread and butter. You're doing modest care dentistry, maybe up to 2 or 3 units per patient, case fees less than $3,500. You can have that type of practice, and that's a very popular practice, a bread and butter practice. Or your choice is a complex care practice, to where the case fees are greater than $5,000. You're doing more than 5 or 6 units per patient. So you got a modest care practice and a complex care practice. The case acceptance process is different based on what type of practice that you want to have. So the first question is, what type of practice do you want? Do you want to do modest care dentistry on a lot of patients, or do you want to do complex care dentistry on fewer patients? That's the challenge for the dentist to answer.
That's awesome. Great response to that question. I couldn't have said it better myself. Let's say a dentist wants to do more complex care. How do they go about giving these patients experiences they will be well cared for?
Yeah, it's human nature for patients to want to be well cared for. I mean, there's no upgrade to human nature. That's been true for 40 centuries. People want to feel that they're well cared for. When you look at the modest care patient isn't really that complex. Case acceptance, the driver of case acceptance for that modest care patient typically is patient education. Here's why. Oftentimes they walk in and they don't really have awareness that they even have any conditions. They don't know they've got interproximal decay. They don't know they got periapical abscesses. They don't know they got impacted wisdom teeth. So case acceptance becomes the driver of case acceptance for those modest care patients. And in so doing, in the educational process, they feel value. However, it's completely different for the complex care patient. The complex care patient, they may not know all their conditions, but they do certainly know they've got dental problems. They don't need another lecture on brush and floss. They don't need to see a bunch of x-rays about all their problems. That train has left the station. They have long-standing chronic conditions, probably because the previous dentist who showed it to them wasn't influential enough, or more likely, it simply didn't fit into their life. So the driver, Elijah, of case acceptance for the complex care patient isn't so much educating them, but rather it's understanding them. That is, creating the new patient experience where the patient has time and opportunity to talk about how they feel about their dental condition. Once you understand how they feel, then you can voice the behavioral benefit. Complex care dentistry is less about explaining how to do the dentistry, and it's more about understanding why the patient wants the dentistry done. Does that make sense?
It does. It does. Thank you.
Absolutely. Yeah. Well, I'm so, it's all connecting for me, because one of the things that we coach our clients is education is important, but making that personal connection and showing, empathy for their situation, and just really connecting with the patient and saying, look, I get you. We're not judging you. And understanding that actually for them to even have walked into the practice and to request help is a pretty big deal. Dental implant treatment, these full mouth reconstruction cases, or even just dealing with a missing tooth can be a pretty stressful thing for a lot of patients. And for most of them, going to the dentist is a totally new thing. And there's a lot of anxiety caught up in that, whether it's around pricing or comfort, or just, just the complexity of the treatment and understanding what it takes to get the smile they want. There's all this emotion that the patients are just looking for a relationship that they can just relax and be cared for, like you said.
Absolutely.
Right. And during all of that patient searching for connection and emotion, the dentist screws it up.
Yes.
By
Sometimes
sitting them down and giving them a lecture on here's step 1, step 2, step 3, step 4, and the patients sit there and they nod like dogs listening to tambourine players, and they get all done, and the patient understands maybe 2% of it, and they go home and they say to the dentist, well, I want to go home and think about it, right? They're not going home to think about it. They're going home to drink about it because they've been overwhelmed. They've been overwhelmed by it. So understand patients, then educate them, as opposed to educating and hoping they'll be influenced.
There's two things that I got out of that, Dr. Homoly. The first thing that I got out of it was relationship. And the next thing I got out of it was emotional intelligence. See, oftentimes we're so focused on that step 1, step 2, step 3, we forget completely about the emotion. And a lot of times, if people feel understood and if people like you, they're so much more likely to go forward with dentistry than if you go over the step 1, step 2, step 3. So the level of importance, you hit that spot on, in my opinion. I thought that made a whole bunch of sense, because you know what? Who cares about step 1, 2, or 3? Who cares about how great of a dentist that you are if you don't have an emotional connection with that patient? So thank you for that.
Yeah. Well, the whole culture in dentistry, we learned at day 1 in dental school or dental hygiene school or dental assistant school. It's the old phrase, inform before you perform. And, and that worked in dental school. You're going to do a filling, so you tell the patient about the filling. Well, now you graduate and you've taken a bunch of CE. And if you still have that mentality of inform before you perform, then you end up going through all the different steps. See, there's no courses in dental school, and there's very few courses in continuing education on connecting with patients. How do you do it? What's the process? It simply is not in the culture. You go to the Chicago Midwinter or the big meetings, and there's 300 speakers, and 295 of them are talking about how to fix a tooth. And there's 5 guys like me or Anissa Holmes or Laura Hatch or some of the great people that we have talking about relationships. We're stuck off in some breakout session, right? It's simply not in the culture. But you know what? The fact that dentists are marketing their practice and that implant dentistry has become safer, it makes with guided tissue and guided surgeries, relatively inexperienced dentists can become very safe providers of implant dentistry now. What's going to happen is that marketing is going to run head on to the process of case acceptance. The more you market, the more the opportunity you have to screw it up with overly complex treatment presentations. There's no question about that.
Yeah. Yeah, you're absolutely right about marketing running right into case presentation. In fact, we actually coach our clients that the marketing is the promise, and their patient experience is the delivery of that promise. And so everything's got to line up, and it all has to be consistent. So the tone and what you're saying in your marketing, you've got to repeat those same things. When the patient is on the phone with you, and when they show up to that first visit, and when you present treatment. So everything's got to be consistent. I just wanted to throw out one more key insight that I just got from our last point before we move on. And that is, like you said, there needs to be a step before the inform. And that means you got to connect, then you inform, and then you perform.
That's right.
That means we got to look at maybe some of the processes that we have in our practice, and to get practical, we need time for that. So I think that's a really important point, is we need to make sure that our patient appointments are structured in a way where we can give some specific focus to make that personal connection. Anissa Holmes just chimed in and she said, tell stories. I think that's a great way to connect with patients. Think about, each patient when you're in your daily huddle in the morning and looking over who's coming in, if you know something about that patient, make a point to make an effort to personally connect. And that means you need time and you need to have some specific strategies to do that.
Well, I'm all for telling stories, okay? But in the case acceptance process, it's more important to hear the patient's stories than to tell my own. You see, a critical strategic or tactical step. Okay, so a patient comes in, they've got a lot of dental problems, they've got a loose partial denture, it interferes with their, they say they're uncomfortable with it, and they're trying to put their finger in the mouth like a lot of patients do, and they talk about this and they talk about that. And once the dentist understands that the partial is loose, 99% of all dentists are going to launch into a conversation about how to fix it. Well, we can do this, we can do that, we can get into the how-to conversation. Here's what I recommend. This is a great tactical step. Once you understand the patient's condition, then stay curious about how that condition impacts their life. You see, severe dental problems, it's a life-altering event. And so when a patient tells me about their loose partial denture, what I'm going to ask them is I'm going to ask them this question, and this would be good for your viewers to write down right here, is that ask this question. Let's say the patient's name is Kevin. He's got a loose partial dentures. I said, Kevin, I understand this partial is loose for you. Can you tell me about a time when this really gets in your way? Is this something that bothers you more at work, or is it a home thing? Give me a sense of how this interrupts your life. Give me a sense of how it gets in the way. You say you use your own words on that, but what you want to do is focus on the phrase, tell me about a time. You want to get the patient into storytelling mode, because as they tell their story, they'll tell you very specifically. So Kevin may say, well, yeah, I can tell you when this gets in my way. I'm a financial advisor. I meet a lot of clients during business lunches or business meals. Halfway through the meal, I've got to get up and rinse my mouth out because the partial's a hassle. And yeah, it's a problem for me every day. You see, as I'm listening to their story, what I'm listening for is what I call the behavioral benefit. You see, it's more important to understand the behavioral benefit than it is for me to explain the process for fixing the condition. So in Kevin's case, once I hear that story, then at some point in that new patient interview, I'll say to him, well, Kevin, let me bring you in back and I'll introduce you to my team and let's take a look and let's see if we can't get you more confident when you're talking to customers during business meals. Now, what I've done is I've given him the experience of being understood. Those are the stories. You want to hear the patient's stories. Those are the more important stories.
Absolutely. That was amazing. So I'm going to ask it again. You work with dentists on case acceptance worldwide for over 20 years. Is there a big mistake that you see most often?
Yeah, the big mistake is that during the treatment presentation, the dentist uses the sequence of treatment as the structure of this influencing conversation. So for example, Helen has got some old composites in her anterior maxillary teeth. She's got some missing teeth. She's got some perio. She's got some endo, and you treatment plan it. And if you present care, in this patient, Helen, she wants pretty teeth. She works at the bank. She interfaces with a lot of customers and high-level people. She wants to be more confident at work. She wants to be able to smile without hiding her smile. You see, I would discover that before I did any examination on her. That's what I was talking about earlier. I would get her to tell her story. Now, during treatment presentation, the big mistake, Elijah, is for the dentist to use the structure of the treatment sequence as the structure of this influencing conversation. See, Helen's got this little voice in her head that's saying, I want pretty teeth, I want pretty teeth. She looks at her friends have got pretty teeth, I want pretty teeth. Now, you sit down and do a case presentation for Helen, 99% of dentists are going to start with what? They're going to start with the perio. Well, you got periodontal treatment, and you need this, and you got impacted third molars, and you've got endodontic needs. And the last thing they would talk about, if it's on the sequence of restorative care, would be restoration of the anterior teeth. And meanwhile, the patient stopped listening to all of that. So the big mistake is that dentists use the treatment sequence as the sequence of influence. What I suggest and what I train is start with the behavioral benefit. Don't start with how to, but start with why. So if I was to give Helen a treatment presentation, I would start it with something like, well, Helen, I've had a chance to look at your x-rays. I remember our conversation the last time you were in. I want you to know that I feel really good about helping you restore your confidence in your appearance at work. I know we can do that for you. That's how I would start. Does that make sense?
Absolutely.
Absolutely. Yeah, you're presenting the treatment as a solution to their problem that's keeping them from having their best life.
That's right. That's what they're there for. Now, I'm not saying that we're not going to present step 1, step 2, step 3, but understand that's a consent conversation. That's not an influencing conversation. And historically, what dentists have done is they've combined a consent conversation and influence. So the case presentation is in the form of patient education because they feel obligated to present the alternatives to care, the benefits, risks of care, and all the technical details, all the while hoping that the patient could put 2 and 2 together and realize, hey, I'll be more confident at work. What I'm saying is, don't do that. Go right to the promise of being more confident at work. Get them to imagine what that would be like for them. And once they feel comfortable with your promise of your outcome and comfortable of how it would fit into their life, once you understand their level of readiness, then do consent. But it's a separate conversation. You can have it at the same appointment, but don't mix influence and consent. And dentists have been doing that as long as I've been in practice.
Hey, I saw that Charlotte had a question, and I think it's important to what you were just saying, Dr. Homoly, because our goal now is to get that behavioral benefit first. And I think Charlotte was wondering, well, how do we actually get into that conversation? How do we initiate that? Is it something that's done in a pre-exam interview, or when do we ask that question? Tell me about a time when this has impacted your life.
Yeah, and nomenclature is really important here. Let's take the phrase pre-exam interview and let's just put it on the side for a minute. It's not a pre-exam interview. You see, that sounds like a grilling. You know, have you ever had diphtheria? And when's the last time you've been to a dentist? And all that technical kind of stuff. No, save that for a different conversation. The pre-exam interview is the wrong label. What it is, it's a conversation. It's a get to know you conversation. And when you change the nomenclature internally, then what happens is people begin to think about it differently. So pre-exam, see, that emphasizes the exam, and anything that happens before the exam is subordinate. No, it's the other way around. This conversation about their chief benefit and their chief condition and their disabilities and how it needs to fit into their life, that needs to be primary. That is as important as the examination is, especially for the complex care patient. So my recommendation for complex care patients, number 1, bring them in first thing in the morning or first thing in the afternoon. That way you don't keep them waiting. Number 2, before you do any clinical procedures, no x-rays, no trip to the hygienist, no tours of the office, no statements about mission statements or giving people flowers or cleaning their jewelry, none of that. What you do, let me get rid of this real quick here. What you do is you put them in a talking area or an operatory and you just open the conversation. It'd be something like, Elijah, if you were my patient and you had a regular spacing between your anterior teeth, I'd say, Elijah, how can I help you today? And you would tell me, you don't like this, you don't like this, you don't like this. And then I would say, well, Elijah, I get it. Is this something that's more important for you at work, or is this something that's important for your home? Give me a sense of why this is important to you. And then I'll just shut up. And that now the patient gets into storytelling and I listen to it. And after the story is finished, I'll say, is there anything else that you're concerned about? well, I've got this over here, I may have this over here, and I'll listen to that. And once I get a good feel for why they are in the office, now this is a complex care patient now. Once I get a good feel for why they are in the office, then I would wrap up the conversation by using the behavioral benefit as the motive to get the exam. I say, Elijah, I got a good feel for this now. Why don't we do this? Let me bring you back. I'll introduce you to my team, and let's see if we can't get you more confident in your appearance when you're doing your presentations and your online work. How does that sound? And now Elijah knows exactly what I'm thinking relative to his needs. And all of this, Charles, this is not a long conversation. When you have the structure, when you know where to go with it, this is probably no more than 5 or 6 minutes. Remember, if you want a complex care practice, if you want to evolve from a modest care practice to a complex care practice, you need to make some changes. It's like that old saying, everybody wants to go to heaven, nobody wants to die, right? Everybody wants to do more cosmetic and implant dentistry, but nobody wants to change their case acceptance process. So there needs to be some changes if you're going to emotionally connect with patients, and do it before you do any clinical procedures. Let the patients know that this is an important conversation. And when they realize that, they will open up, and now your practice will feel different and the patients will respond differently to you.
That's great. So this is something that I would say the most common question from all of our practices that we do dental implant marketing for, and people that watch these live cast videos. How do you deal with shoppers? Because people don't like shoppers. They seem not to like them. How do you deal with shoppers?
Well, if I have a practice telling me they don't like shoppers, I would ask them this: would you rather have shoppers or no shoppers? See, shopping is called normal. It's normal behavior. And if you're going to market, Charles, what you're doing is you're inviting shopping. That's why department stores have windows. That's why they have websites. You want shoppers. The problem isn't with the shopper. The problem is with the person that's answering the phone talking to the shopper. Because, see, oftentimes the front desk people, they got 4 things going on at one time. They're checking out patients, they're making a payment, they're dealing with this person, and the phone rings. The phone is always an interruption. It's always interrupting something else that they're doing. And so one of the issues with dealing with shoppers is that you need to, and I would recommend this in your marketing, have a dedicated line for new patients. So when that new patient calls, that line lights up. So when that line lights up, you hit the button, you pick up the phone, or however you do it. Now you're prepared mentally to deal with this. Shoppers are good. And if people are tire kicking, I want them tire kicking in my practice, not in somebody else's. So it's a change of attitude that's required. And so, Charles, you're going to have a headache like no tomorrow. If you're doing aggressive implant marketing and you're working with an office that they're all constipated about, well, we don't want to change, we don't want to deal with shoppers, then don't market. Don't market. Just go on word of mouth. Learn to love shoppers. And with shoppers, it's real easy. Just listen to them. And then after they're done talking, say something like this: well, Charles, I know you're concerned about fees. Would this be okay for you? We reserve time, especially in our schedule, for patients like you. Why don't you come in for a 15-minute consultation with the doctor? There's no charge for this. And he'd be glad to sit down with you and talk to you about your concerns. Would that be okay? Now, what you've done is you've taken price out of the equation. Now they come in for that 15-minute consult, no diagnosis, no x-rays, no nothing. And then what you do is you do this bit that I did earlier about learning what their behavioral benefit is. Once you do that in that conversation, it will showcase that you have the capacity for empathy, that you've got the capacity and the interest of really being interested in providing them the outcome they're looking for, as opposed to a transactional relationship.
Absolutely. That's exactly what we coach. I think you worded it a lot better than what we've done. But I mean, absolutely, Your shoppers are exactly who you want. And I think
Bring on the shoppers.
yeah, exactly. Well, here's why. I mean, number one, shoppers are probably more educated about the procedure because they've probably seen other dentists already. So that means that there's kind of less work for us to help the patient understand we're not starting from scratch.
Absolutely.
Number two, they're in our office. They're still looking. And so that means that they, even after what they have learned so far, they're still very interested in going through this process and getting the smile that they're wanting. But something's missing. And so that's why that conversation that you're talking about is so important, because they haven't found it yet. They haven't found the one, you know, and they're still going from office to office, trying to get that, either the connection or to the sense of feeling cared for, or maybe, yes, having the right financial options in place so they can actually fit the treatment in their budget. They're looking for one of those things, and it's our job to figure out what that is so that the patients can say yes. So shoppers are absolutely the greatest people that should be walking into our practice.
Let's get clear about one thing. When those case fees get above $10,000, okay, and that's really easy to do with implant dentistry. When those case fees get above $10,000, I've surveyed thousands of dentists for over 2 decades. Here are the facts. When the case fees are over $10,000, fewer than 5% of the new patients are ready to start their care. They're not ready. It's not that they don't want the care. It's the fact that it simply doesn't fit economically into their life. They need to get their house in order. And so oftentimes what I'll do with the patient, when I present care to a complex care patient, and maybe they're hearing the treatment plan for the first time, Charles, I'll make the assumption, listen to this, I'll make the assumption that they're not ready for care. I'll make that assumption. Here's why. Because I'm probably right. And I'll present care in such a way that even though they may not be ready for it, they'll never forget how well they felt by the way I offered it. And as they go through the readiness period, getting their house in order, kids graduate school, maybe they get married, maybe they get divorced, whatever the life event is that instigates their readiness, they're going to go to where they feel understood. So, you know, Charles, I'm not telling you what to do as a marketer, but one thing I would get really clear, especially in implant marketing, don't make case acceptance. Don't make immediate case acceptance a condition of a good continuing relationship with complex care patients. Wait it out. That's why you have that's why the best implant practices have a strong modest care component to it. Because you really, especially if you're just starting in implants, the cash flow when you're starting out with implants is going to be relatively low. Where your cash flow will come from is from that modest care practice. So you've got the modest care practice that's generating income and paying your overhead. You have the complex care practice that's the direction of your development. You have both. That makes sense. So
absolutely,
don't make immediate case acceptance a condition of a good continuing relationship, because most dentists, most general dentists will say that their biggest cases have been in the practice for over a year.
Yeah, we say that all the time. I mean, sometimes it just takes a few interactions with your practice before the patient's ready to say yes to a $10,000 plus treatment. So, I mean, start them with their next cleaning, or maybe there's another smaller procedure that's a first step before they can get into the more comprehensive stuff. So they came in with a dental need. We've got dental solutions. They should be saying yes to something. And by taking away the pressure for them to say yes to it all, definitely is going to go very far in building trust.
Absolutely.
One of the other things too, I mean, you said it's a $10,000 treatment. I mean, just think about that. Shopping is totally normal. I think that's something you said just a few minutes ago. And
bring the shoppers on.
Of course the patient's going to shop. I mean, you think about some of the $10,000 plus purchases we've made as consumers, whether maybe it's a renovation in our house or a car or something that when it costs that much money, we should expect patients to shop. And so we should plan to have these conversations when they walk in, you know, with other quotes or with concerns about pricing, because this is not a normal everyday purchase. This is a significant financial investment. So we just got to kind of make that's part of the whole conversations that we're going to be having. We should be expecting shoppers.
You bet.
Dr. Homoly, I have a question. So you say you go into it, and you don't necessarily expect them to say yes on the first knock at it. Do you have any kind of advice on getting patients to become a patient of record, meaning a hygiene patient, regular patient, if they don't accept treatment? Because you're doing all this marketing, and sure, you might have to build the trust up over a year period of time, but but how do you get them to become a hygiene patient in your practice?
So what was the question? How do you get them to become what?
How do you become them to be part of your practice, a new patient, a hygiene patient? And even if they're not ready to start doing that high value case, how do you get them to become part of the family?
Well, it all goes back to not having the expectation of them saying yes the first time they hear their treatment plan. One of the things that I ask patients as a part of what we call case conversation, not case presentation, but case conversation, is I'll say, Elijah, I know I can get you comfortable with your appearance in front of audiences when you're speaking. I know I can do that. But what I'm not so sure about is whether this is the right time for you. And the reason that I say that is you told me you're traveling internationally, you're running several businesses. I know we can help you. The question that I would have for you is now a good time? Or maybe we wait until after your busy season? Or maybe we do it a little bit at a time? Help me understand, how do we best fit this in for you? Now the dentist needs to shut up, right? And now, Elijah, you're going to tell me. You might say, well, you know what? It's a little crazy right now, and I'm going to Europe, and I got this deal going on. We're going on a cruise. It probably would work better for me maybe starting next January. I would say, well, terrific. Most patients take time to make this decision. Let's do this. Let me put you in our ReCare program with Rita. Rita's our hygienist. You're going to love her. She's been with me for 12 years. Let's keep an eye on you, and then January, we'll revisit this conversation and see if it's a better fit for you. Now, it's January. Here you come. We see your name on the schedule. Rita and I talked, and I say, hey, Elijah's coming in. Be sure to revisit his fit issue. The fit issue is how does dentistry needed to fit into his life? Ask Elijah how his speaking is going, how his travel is going, and then make the offer to revisit care. So now I'm the hygienist. Elijah, you come in. I go, Elijah, welcome back to the practice. Hey, before we start, has there been any change in your medical history? And we do that. Has there been any change in your dental history? And we do that. And then I would say, well, Elijah, last time you were in here, you mentioned that you're doing a lot of travel and you're doing a lot of speaking internationally. Is now a good time for us to revisit the recommendations Dr. Homoly made? Or in addition to that, maybe we clean your teeth today. What is better for you today? Okay, so now the hygienist has reintroduced the opportunity to revisit. See, the trick here, if there's a trick, I hate that word, but the strategy here is revisit the patient's life circumstance before you revisit the untreated condition. A big mistake that hygienists, and I love hygienists, don't get me wrong, it's not that I'm anti-hygienist, but the big mistake that I see with dental hygienists is that the patient comes in and they revisit the condition. Are you ready for the bridge? Patient says no. 6 months later, you ready for the bridge? You really need it. Mesial drift, supereruption, pterygoid issues, condylar, all the stuff. No. 3 months later, you ready for the bridge? No. 6 months later, don't talk to me about the bridge. And you write in the record, don't talk to this patient about the bridge. 6 months later, broken appointment.
Yeah.
And then you look at each other and say, well, Elijah's got low dental IQ. No, Elijah doesn't have a low dental IQ. Elijah doesn't like being nagged. And I tell you what, when a patient isn't ready, I'm talking about a complex care patient. When a complex care patient isn't ready and you over-educate them, it begins to feel like sales pressure. And when patients feel sales pressure, game over. Go back to carbon wax in a lab somewhere, because the game is salesmanship and complex care dentistry does not go together.
That's awesome. That's awesome. So let me ask you, what is something that dentists can do immediately to improve case acceptance for complex care?
Wow. I kind of talked about it earlier. Start with the behavioral benefit. Get really clear about why they want to get their teeth fixed. Number two would be, let's say you got this much time for your new patient experience. I don't care how much time it is. Let's say it's an hour. And typically in that hour, probably maybe 50 to 70% of that time in the new patient experience is spent educating patients. Here's what you got in your mouth. Here's how you got it. Here's how you can prevent it. This is how we're going to fix it. All this process-centered conversation. I'm not saying any of that is wrong. I'm just saying all of that is limiting. And if you've got this much time, what I'm saying is, I'm not saying you don't educate your patient. I'm just saying cut back to a pack a day on this stuff. Cut back on the amount of time you're educating patients and use that remainder time to understand patients. Be curious about how their conditions impact their life. My first 10 years in practice, I did everything. I did nothing what I'm saying right now. I was doctor, professor. This patient could have had 6 kids in college, divorced, and a kid with cancer. I wouldn't have known any of it because I was focused on the pursuit of excellence. In my last 10 years, I really realized that the case acceptance process was not so much them understanding and agreeing with my treatment presentation, but it really was all about them understanding and appreciating who I was. See, what I allowed myself to do was to reveal my character to these people. And I did that through storytelling. I did that through empathy. I did that through taking time to have conversations with them so they didn't feel rushed during appointments. And I'll tell you what, that's a hard thing to do, especially if you're a modest care dentist and you're seeing 90 new patients a month and you're running from chair to chair to chair and you got this vision that you want to do more implant dentistry. It's very difficult for those dentists to take time to evolve. It's really tough to earn and learn at the same time. People need to get that.
Absolutely. I want to bring you back to something that stuck. I had asked you, how do you get a patient that comes in for a high value treatment?
Right.
If they leave, how do you get them to stay as a normal patient? As you were explaining the answer to that, you mentioned the next time they come back a year later, they're sitting in the hygiene chair.
Right.
And the dentist asks them something along the lines of, you want your smile to look better, you want to feel more confident at work, whatever it may be. And you said you were traveling a lot. Is now a good time to have that appointment, or would you rather just have your hygiene appointment? You said something along those lines I've never heard before. I love it, and I just want you to dig in just a little bit with that. Can you?
Yeah, sure I can. You see, by revisiting the life condition first. See, by me revisiting what we call fit issues, how the dentistry needs to fit into your life, by me revisiting your travel and your schedule, that acknowledges and honors your life. See, the dental hygiene appointment is not about the hygienist, it's about the patient, and we lose that focus. So by revisiting the fit issue, Elijah, are you still traveling? Is now a good time? And if Elijah says no, if you say no, I'll say, I understand, let's go ahead and we'll do your procedures today, and next time, if it's okay with you, we'll revisit it again. Would that be okay? So you may come in next time, right? 6 months, let's say, Elijah, well, I stopped traveling international. I'm done with all that. I'm working out with CrossFit. I'm a new man. You say, terrific. In light of that, would today be a good time for us to revisit the condition? You say, well, not really, because now I'm involved in this XYZ business and it's taking all my time. I go, hey, I got it. Then so let's just go ahead and do your procedure. 6 months later, you come back in. I say, Elijah, how's that XYZ business doing? You say, it's crazy. I'm suing everybody. I'm getting the hell out. I go, well, in light of that, would now be a good time for us to discuss your conditions. You see, my recommendation about discussing your conditions never changes. I'm always offering a complete care. But what I do, Elijah, is I temper it, or I acknowledge your life event. That puts me on the same side of the chair as you. And if hygienists would learn to do that, if dentists would learn to do that, boy, and what you do is you just wait them out. At some point, there'll be a life event, a death, a birth, a wedding, a business transaction, or something that will make having great teeth, great appearance, great confidence really important to them. And you know what they'll return? They'll return to you. Why? Because you took the time to understand them. There's no question about that.
Absolutely. That's awesome.
Yeah. Hey, I just wanted to recap before we move on to the next one, because I mean, I think if we had some actionable steps, like I think we just went through those in the last couple of minutes. And so, number one, like focus on that behavioral need. That, what is it? How is it their problem impacting their life right now? That's number one.
That's right.
Number two, build the time into your patient experience so that you can personally connect and make that an intention of every single team member who's interacting with that patient, the doctor, the hygienist. You're making that personal connection. And then if I can add something, I would say number three is have a follow-up system. So that means that while you're making these connections, you got to have a process in place so that everybody can stay on the same page. And so when that patient walks in the door 6 months from now, you remember that life event that was so important to them. And that the doctor remembers to remind the hygienist, hey, ask about that thing. And then let's bring up the dental need. So we can plan for those conversations without it coming off as feeling inauthentic. And to make sure those patients don't slip through the cracks. We need to make sure that we stay in contact with them so that we can continue to offer our best solutions, but do that in a way that's not pressure and that's actually customized to their lifestyle.
Yeah, you know what, Charles? Dentists and hygienists and team members are really good about documenting patients' conditions. They, just think of the periodontal chart: 2, 2, 3, 3, 4, 4, 3, 2, 4, 4, right, all along the line. We can document that. It's very simple. It's very simple to document patients' life events. I've created forms. In case acceptance. We can talk about that a little bit later in this conversation about how to document life events. So when Elijah comes back in for a 6-month appointment, all the hygienist has to do is look at this form where we've documented the behavioral benefit, the life events, what's going on. She can take 15 seconds to review it. And when she talks to the patient doesn't know she reviewed it 15 seconds ago. It will seem like, wow, she really remembered me. That's relationship. You have to evolve from transactional relationships to meaningful relationships in order to have a complex care practice. And that's not in our continuing education. It's not in our culture to do that.
Awesome. Well, they're getting it here. So.
They're getting it here, yeah.
Absolutely. Now I want to go ahead and ask you one last question before we wrap up with the end questions.
Sure.
What do you recommend for our listeners to do to continue their progress in improving case acceptance?
I would say this: if those people are listening to me now and listening to this conversation, if any of this resonates with you, if you're thinking, wow, maybe I haven't heard that before, but you know what? That makes sense. It might make you a little uncomfortable to hear me say some of these things, but maybe there's a little voice in your head saying, I'd like to learn more about that. What I've got is on my website, I've got a free video series called Your 3 Top Decisions to Make It Easy for Patients to Say Yes. All listeners have to do is go to my website, www.paulhomoly.com. Right at the top of the homepage, you'll see a block there that says Your 3 Top Decisions to Make It Easy for Patients to Say Yes. And what you'll get are 3 videos. They're 5 to 7 minutes long. There's a couple study guides with it. It's great for team meetings. You can use it as a staff meeting. And so much of what we said today about benefit and fit issues and readiness are in that. So that's a great next step. It's free, it's fast, it's easy. And that would be my recommendation.
Awesome. And you know what? I want to go ahead and just say this. I have personally taken that online series, and I have never heard a better case presentation explanation than you have on there. And you have a couple of levels. Can you tell us about that? Level 1, level 2?
Yeah, the levels really are designed for where the dentist is. There's some dentists are right out of school, maybe they've been in practice for a couple of years. It's really not a reasonable expectation for them to start doing full mouth reconstructions. They simply don't have the skills and experience. And that's good. But you know what? They too need help with case acceptance for the bread and butter stuff. For the more advanced dentist who's been in practice for years and has taken a lot of CE, they've been to the Dawson Academy, they've been up to Coist, they've been, maybe to the Mish Institute to learn implant dentistry. They have all this accrued knowledge, but they're kind of stuck. Again, I said it in the beginning, case acceptance is the rudder of the practice. Practices evolve in the direction where the practitioner is most successful with case presentation. And you can have all this training, but if you can't influence patients to stay in your practice, so when they become ready, they'll choose you. If you can't do that, then you're not getting return on your investment for your education. So, my sense here is be patient with the process. Be patient. If you were to study my material diligently and work at it and implement it as I've designed it, it's going to take you close to a year to do it. Here's why. Nothing this important can happen fast. It's a change of mindset. It's a change of behavior. And to get into and I see this all the time online. I see, hey, here, learn tips and tricks for case acceptance, or here, say this, don't say that, or when the patient says this, you say this, or here's how to overcome objections. Fine. I don't buy any of it. I don't buy any of it. For real relationship change to occur in a dental practice, it takes diligence, it takes study, and it takes time, just as much as learning occlusion or periodontology or cosmetic dentistry. You don't learn that stuff in one day. You don't hear Peter Dawson one time and learn everything he's got. So I would say be patient with the process. Take it step at a time. Know what you want, and then develop case acceptance in that direction. That'd be my advice.
Absolutely. So we have some questions that we're going to go ahead and ask
Sure.
from our viewers. I'm going to start off by this, and I think that you might have already answered this, but I'll say it anyways. When is Dr. Paul Homoly going to release an online training course? I think we just reviewed that, huh?
Glenn Bowe. I was just with Glenn. Glenn's a chirpy, nifty, thrifty Glenn. I love it. He and I spent 2 days together here in the Scottsdale area. The online course is already available. It's called Making It Easy for Patients to Say Yes. Again, you can go to my website. You can look at the 3 introductory thing, or you can just dig around on my website. You can find the course.
Absolutely.
But it's available now.
All right, so it's available now, Glenn. Go get it right away.
He's already got it. Glenn has already got it. I saw on my internet. I get a little notice when someone enrolls in the program. Glenn Bowe. I went, all right, here we go. Nifty, thrifty case acceptance. I love it.
If you guys don't know Glenn Bowe and you want some amazing deals, you need to go listen to that podcast, Nifty, Thrifty Dentist. And
I love the guy. I love the guy. He's terrific.
Absolutely. Another question, or this is a comment. Daniela, Dr. Daniela says, I'm playing this for my team. So she's going to play this for her team. Would you say that your videos that you have on your website are appropriate for the entire team?
They're designed for the entire team. You can't do this without the entire team. The online program is designed for you. You'll receive a couple lessons a month, then once or twice a month, depending on how much of a gunner you are. You take about an hour in staff meeting and you play the video. It'll be me, just like now, talking to you. And then there's work guides, there's study to it, and then there's applications to your practice. So an hour or 2 a month, it's designed for the team. You can't do this on your own. No. It's designed for the team.
Awesome. Good questions, you guys. This is a comment from Dr. Ed Martinez. He says, Dr. Paul Homoly, what you have spoken of today is wonderful and reminds me of this great read, How to Win Friends and Influence Others, DC. Thank you for sharing your ideas.
Yeah, well, what I'm talking about, I said it earlier, the human need to want to be well cared for, that's timeless. And you go back into literature, you go back to the early literature and the spiritual literature or the lay literature, and you'll find recurring themes about well-being, safety. People respond to being well cared for. I've had an atrial fibrillation issue with my heart for years. Let me click out of this thing here real quick. And I recently moved to Scottsdale, and I enrolled in the Mayo Clinic. And, I'm not a cardiologist. I don't know how to treat it. I'm in normal rhythm now. I'm healthy as a horse. But I guarantee you, when I walk into the Mayo Clinic, I'm looking at everything. I'm looking at how the nurses talk to me. I'm looking at how the doctors make eye contact, how the administrative people deal with me. I'm looking for signs that I'm going to be well cared for. And too often, we're focused on efficiencies in the dental practice. And what happens is we're running from room to room, and people don't get the experience that they're looking for. They're getting an efficient experience. No. Give them an effective experience. That's the big difference.
Thank you for that. Charles, do you have any last comments for us?
I was just going to say, I mean, that's a continued theme, what Paul just spoke about. And it's one of the reasons that Driven Dental Implant Marketing even exists. And that's to make an impact, in the lives of others. Most of you listening to this podcast, or watching this live cast, you got into dentistry to help people. And so when you keep that front and center, when that's like the core of your intention, when you're at work every day, is how can I make a difference in someone's life? It makes it easier for this mindset shift that Dr. Paul is talking about to go from the efficient and transactional to more that connection. If we just keep that a focus every single day and look at the patients that are calling us, that are walking in our practice, and they're looking for help, this is life-changing dentistry, especially when you're going after high-value dental implant treatment. These are the cases where the patient walks in one person and walks out someone totally different. And you'll find, if you master the conversations that Dr. Homoly has talked about today, and patients are sharing with you, how are these problems impacting their lives, that we can totally transform their experience. We can help them get better jobs. We can help them connect better with family members. We can help them find the love of their life or be
Absolutely.
a better version of themselves. And I think that's so motivating. It's so exciting. And for me as a marketer, it's one of the things that drives me every day to feel part of the teams that we work with to help them make this transformation. So I just want to leave it with that, because that's what gets me pumped every day to do what we do.
Well, when you say the word marketing or label yourself as a marketer, the word marketing, it sort of instigates sort of a consumption mindset. Hey, market your practice, make more money, have more time, consume, consume, consume. And I'm fine with that. I am. I believe that the antecedent to clinical quality is practice profitability. If you're profitable in a practice, then you can afford good equipment and good labs and the finest staff and all the juice that goes with a great practice. But the real leap that practitioners will make is when they use marketing, but not so much for a consumer intention, but rather a contribution intention. I heard you, Elijah, talk at Smiles at Sea. I was sitting in the audience and you talked about climbing the ladder. Remember that? Yep. And you said, I'm going down a couple steps to help other people up. See, your intention is not consumption. Your intention is contribution. And the only way that a practitioner can make that jump is that they have enough financial security in their life, they have enough self-confidence, they have enough experience. I guarantee you, Elijah, if you were broke, you wouldn't be talking about contributions. You'd be looking for consumption. But you've reached the point in your life where now you can make the shift, or you've already made the shift. What I'm saying, Charles, what I'm saying to you is that get your clients to see that the bigger picture of marketing is contribution. And the more you contribute, the wonderful irony to this, and I'd like to hear your comment on this, Elijah, the wonderful irony of contribution is that the financial rewards compound in the intention of contribution. Would you agree with that, Elijah?
Oh man, that's everything that I stand for. Some people don't understand because they're constantly after the dollar. They're after the dollar. And
that's right.
It's almost, I would say, in majority of people's human nature to be after the dollar. But what some people have really, truly grasped and understand is that when you actually don't care about the dollar and you really genuinely care about changing people's lives, that dollar actually grows. And so you're focused on someone else and not yourself. And by accident, you happen to grow on the way there. And so we're all here to change people's lives. And something that stuck out with this entire video or live cast or podcast that you said was, as you said, you can't come in expecting the patient to necessarily say yes, but you got to build that relationship, and you have to have empathy for that patient, and you have to make them understand that you actually care. See, that mindset there shows me that you are out for the patient. And you know what? They'll come back around eventually. And I think that's absolutely amazing. That was my biggest takeaway is you know what? It might not happen now. It can happen a year later, but they will remember the emotional connection that you had with them. And I just, I'm blown away by that. Hey, Linda Miles is joining us today. Huh? I'm sure she is as well. So
Yeah. I hired Linda Miles when I was a baby dentist, when I was a young dentist. Linda came to my office in Charlotte and whipped me into shape. She was one of the first ones to give my boulder a push down the hill. So Linda, bless you. Great to see you. I love your hair too, by the way.
Absolutely, absolutely. So, hey everybody, thank you so much, Dr. Paul Homoly. One last time, if they want to reach you, can you tell them how to reach you?
Yeah, my website. Go to the website, www.paulhomoly.com. If you're interested in the case acceptance coaching or the online, just click on your 3 top decisions to make it easy for patients to say yes. Plus, I am going to be a guest speaker at Smiles at Sea. Yes, coming up, the Cancun cruise in September. It's going to be my birthday. Golf balls would be nice. It'd be a very thoughtful gift, very thoughtful gift. But I'll be a part of the judge for Dentistry's Got Talent. I love that event that you put on. Plus, I'll be on the cruise. I'll be doing an event there. I'm going to hang out all 3 days. So bring it on, everybody. And Charles, thank you for the contribution that you're making to dentistry. Marketing is not simple. You really got your work cut out for it. But my friend, you've got my respect.
I appreciate that. Thank you so much.
And I'm going to end on three different quick things. The first thing is, if you are a dentist or a dental team member and you really want to get into placing dental implants and you have not started, but you want to get into it, we actually are doing a course November the 15th to the 19th from Fort Lauderdale to Cuba with Dr. Arun Garg, and it's called Implants Unlimited. It happens to be on a cruise ship. Many of you know me for a cruise. But by the time you get off that ship, you're going to know how to place simple implants, straightforward cases, and also do socket preservation. So if that's you, please make sure to reach out to us, and we'll give you all the information on that. And then another thing is, if you are liking this way of learning, right? We're doing these live casts. If you want to be more of a part of it, please make sure to go and like our Facebook page at Driven Dental Implant Marketing. And then what we're going to do is we're actually going to put the next event that we will be having in the events section, so that way you can alert yourself. That's another thing. And then lastly, if you're interested in seeing if Driven Dental Implant Marketing is a fit for you in your dental practice and you want a free 15-minute strategy session with Charles and I, go ahead and go to www.drivendentalmarketing.com. And Greg May says, market with Driven Dental, period, first step. All right. Thank you, guys. Thank you, Charles. Thank you, Dr. Paul Homoly. We'd love to have you back anytime as a guest on our live cast. Thank you so much.
Okay, see you, everybody.
Take care.
Have a good night.